Thank you again, Dr. Bali and Dr. Chaib, for inviting me to talk about autoimmune diseases. And again, I also apologize for the delay, and I've been quite busy. Today, I'm going to share with you some of my learnings and experience of integrative low carb, also molecular medicine for autoimmune diseases. And this is about me. And well, this is my first case of autoimmune diseases, which is a psoriasis case. I met this patient many years ago here in my American clinic. This is a young man, about 30 years of age, was overweight, obviously. He was shorter than me, probably about 5'8", 5'7" ish feet. I mean, maybe about 173 centimeters. And he was 300 pounds, which is about 140 kilogram. And he came in for weight loss primarily with other issues like depression, low self confidence. He also had a severe psoriasis with these skin rash, the white, scaly rash all over his extremities, all over his body. And he came in was covered, clothing covered these things, and I didn't really notice that much. And he sought medical treatment all over the place and never really achieved much progress. So when he came in, of course, as usual, we prescribed a diet and also we prescribed the nutrition, among other things, to him. And what happened was, in a couple of weeks, his skin rash, it's about 2 weeks, his skin rash gradually improved, disappearing. And his mother came in and talked to me about it. She said they were very surprised that the rash was improving. And I said, well, I realized, yes, of course we know that a lot of skin diseases actually are connected with our gut, with the internal medicine issues. And I remember a lesson that I learned when I was in medical school from a dermatology professor, and I didn't understand at the time. He said that to be a good dermatologist, you first need to be a good internal medicine doctor. And that now I think I begin to understand why. Anyway, long story short, so he came in and he not only lost weight but also skin rash disappeared. All the psoriatic lesions, rash disappeared in about a month or two. And as you can see on the picture here, on the left, pictures are a little bit small. You can see those patches of scales. In the center is about 2 weeks later, the rash were beginning to disappear. On the right is when I saw him about 11 months later, completely gone. And not only that, he also lost about 200 pounds. That's when it clicked on me in my mind that actually we know psoriasis is a autoimmune disease, and it has a lot to do with our diet. So that's my first case, and I began to pay more attention to these autoimmune diseases of skin because we know one picture is worth 1,000 words, and these skin rash actually respond to the nutrition or functional medicine, also molecular medicine protocol. Now this is another case of mine. Actually, this is my schoolmate. He was a pharmacy major. He was a CEO. He is a CEO of a pharmaceutical company in Shanghai. Anyway, so he started talking with me. He wants to know. He has open-minded this. That's the good thing. Anyway, he had this skin rash of psoriasis on his legs, localized, like the first case, all over the body, and it's been bothering him, but not as bad. However, anyway, early on he didn't really, he was skeptical about all diet and nutrition. But anyway, so he tried what I was telling him. In about a month or two, he found that skin rash was improving, and he went back to the regular style, average diet, and went off the nutrition supplementation, including vitamin C. The rash came back. So he was totally convinced that this is the right way to go. and that was probably 5, 6, 7 years ago. And now he's been on low carb diet. He's been regularly taking these nutrition supplements. So the rash never came back again. And although he is the CEO of a pharmaceutical company, his company still sells drugs for a living. However, he doesn't believe in drugs anymore. He, privately, he really trashes drugs and promotes nutritional medicine. He's now investing more and more into alternative medicine, the lifestyle and nutrition. Now, this is another longtime friend of mine, and I've known him for over 40 years. And this was back in summer of 2018 when I saw him. He came to see me, and so you can see clearly on the picture vitiligo, which is another autoimmune disease. Okay, I told him about what I said, and of course he also took my words partially. At least he cut down on the carbohydrates, and he also took some vitamin C. He didn't go all the way. You can see clearly the following year, exactly about 1 year later, you can see that the white patch, the vitiligo, significantly improved. Actually, this is not the first case of vitiligo improvement, because the very first time was a friend of mine, a high-ranking executive, told me that after he started taking vitamin C, his vitiligo on the skin, on the hands, improved. Unfortunately, he didn't take pictures, so I have no pictures to show you. But that was the first time I heard of vitamin C improving vitiligo. And ever since then, I had a few other cases. Now, this is a recent case about 3 years ago here in the United States. A patient of mine. Anyway, this is a middle-aged lady, Caucasian lady, with a severe skin rash, as you can see here on the arms. Actually, on both arms, very bad. And she also had abdominal pain discomfort. So she had a skin rash and GI symptoms. She went to see a skin doctor. She went to see GI doctor. Took biopsy, took CT, but they couldn't find anything. They couldn't help her. So she drives by my clinic. Our clinic is by the roadside, and saw integrative sign, a medicine sign. So she figured out. But she told me she was to the point that she had to quit her job because she felt fatigued. Her mind was foggy, low grade pain. Of course, I understand that. If I had low grade pain, I won't be able to function. So this bothered her for more than 6 months. Anyway, she stopped by, and actually she started complaining about these issues to me within 10 minutes. I think I already know what she was talking about. But I let her continue for a little while. Then I started telling her, I said, I think I know what it is. Well, the same story. Basically, I believe mostly issue is in her gut, in the diet. The gut was causing the leaky gut and also the whole 9 yards of autoimmune reaction. Long story short, I prescribed a very similar approach of dietary control, nutritional supplement, gut repair. Well, within 6 months, let's see, next picture here. This was within like 2 weeks. You can see on the left, you see some redness, but the rash was significantly improving. And about 2 months later, after that, I went to Shenzhen to talk in China to attend a conference, give a lecture on low carb medicine. But anyway, when we came back 3 months later, she came back to see me, really thanking me for this. And you can see the rash was completely gone. Okay, yes, it is an autoimmune process. And alopecia, I'll go quickly. A few other cases, as you can see, this is what one picture is worth 1,000 words. And that's what it is. Of course, this I took from my Chinese presentation, so you can see the carrot. But you don't need to read the text. You know what it is. And this is another Chinese case in Shenzhen. You can see this is a 70-year-old, I think 72. Her daughter is a fan of mine on social, a client of mine, and the mother has been suffering from these very bad rash for like 20 years, and along with other issues. So she came to me. I prescribed diet and nutrition supplement. Within like a month, you can see the skin rash significantly improving, and she of course becomes very much a fan of mine. And a few other cases. Here is a recent case to last year. a young nurse. I think she's like 30, 32 years of age with a idiopathic thrombocytopenic purpura. So basically, she had bleeding spots in her arms, and her platelet count was as low as 20,000 in March of 2021, which is what now is September 2022. So more than a year and a half ago. And so, but she's a nurse. She didn't want to go on the standard corticosteroid therapy or that. So she found out about me and she came to our service. That was uh, about summer of 2021, over a year ago. Anyway, so I prescribe very much similar diet and nutrition supplement because I believe all these autoimmune diseases share a lot of things in common. Although these diseases may have, some variations between disease and between individual patients. However, the same line is very similar. So here in October 2021, the normal bleeding and also platelet count went up 300% over 60,000. Now, actually, I didn't write down here. She also took vaccines, COVID vaccine. After vaccine, her platelet count dropped significantly. The bleeding spots came back again, and she called me, and so I told her to go on high dose antioxidants to suppress the autoimmune reactions, which helped to bring her platelet count back again. And so we're not going to talk too much about that today. This is a case of ulcerative colitis, a 37 years old woman with very bad ulcerative colitis with diarrhea, bleeding, yes, bleeding very bad. And she went to many places in China, including Shanghai, had steroid, all these standard treatment, but didn't help much. Here, colonoscopy proven, and she came to our service actually within a couple of months. So her symptoms and also on colonoscopy, all these things improved. She no longer had the bleeding in her colon, and she was very happy, and she's maintaining on that now. This is a type 1 diabetes. I have a couple of young kids on my program. This is a 6-year-old girl with type 1 diabetes for 3 years. She's only 6 years old. She's been having most of her life actually. Anyway, pretty complicated and a lot of auto antibodies. And she came to our program and went on the same a very similar approach. As you can see, I'm not going to go over the detail, but many of these autoimmune antibodies begin to decrease. Okay, not entirely reversed or cured. However, she's on the right track. Her insulin usage is going down. Of course, ketogenic diet here. And so sugar is stabilizing. Insulin requirement is reducing. Antibodies are improving, reducing in numbers, and also her overall feeding fatigue is improving. I have quite a few. I think I counted like 5 or 6 Hashimoto's thyroiditis up to now, improving. And this is one of them, 34-year-old diagnosed of Hashimoto's in 2020, which is 2 years ago, was elevated autoantibodies of TPO antibody and the thyroglobulin antibody. And she not only went on diet, but also, high dose vitamins, including vitamin C, D3, niacin, yes, B3. She also went on BHRT because she also had an irregular menstruation. And after a couple of months, you can see the first one is the anti-thyroid globulin antibody, which went below normal, and the TPO antibody went significantly from about 1300, which is the max, and down to a little over 200 on the way to improvement. The second case of Hashimoto's thyroiditis this is a 25-year-old woman with Hashimoto's. As you can see, these red upper arrows here. The TPO was more than 2400. The TGAB was above 800. And this is a repeat exam actually last month, all the antibodies normalized. She's now normal. And this is the third of Hashimoto's thyroiditis. This is a woman of 46 years of age, and back 2 years ago, her autoantibodies were mildly elevated, not too bad. The TGAB was 72, TPOAB was 62, and the repeat of August of this year, all these were normalized. And also, she had other issues, including blood pressure and kidney stone. On the repeat exam, they were gone. Well, why is that? Is because our approach actually is not particularly just for Hashimoto's, it's for the overall body. Because Hashimoto's or these other chronic diseases, as we've been saying, these are the clinical manifestations of many things gone wrong in our body. Okay, so we're going to discuss a little bit more later. The fourth case of Hashimoto, this is a man. Yes, men can have Hashimoto as well. 50 years of age man. Not only Hashimoto, he also had an early stage of renal cell carcinoma. But anyway, talking about thyroid, a year ago, June of 2021, he had elevated TPO AB and also TGAB. As you can see, TPO was above off the chart, above 1300. TGAB about close to 300. And May of this year, which is a year later, both antibodies are significantly improving, not entirely reversed, but improving. Overall, his body, he feels much improved energy level, many other issues. So his whole family is on my program now because, again, he feels he's on the right track. We are sort of delivering promises to these patients. So as we know, autoimmune diseases are incurable. With our traditional Western medicine, there's no cure. Actually, for that matter, which chronic diseases does the traditional Western medicine offer a cure? No, not to my knowledge. This is the fifth case of Hashimoto, a young woman, 32 years of age. This woman, a poor lady, not only has Hashimoto, but she also had type 1 diabetes. She also had irregular menstruation. She had anxiety. She has a GI problem, a lot of problems. And she is from a relatively well-to-do family, so she did a little bit more extensive workup. Here I show you some of the tests we did. And you can see here on the left is the hormonal profile. We tested her, the functional medicine approach, tested her DHEA, progesterone, all the three, estrogens, progesterone, testosterone. Practically, she's only 32, young woman. However, if you look at her estrogen or her sex hormone profile, look like she's postmenopausal. She basically has ovarian failure picture. Okay, no wonder she didn't have the regular menstruation. Then here in the center, I just put them together here because for space, and we test her toxins. This is the panel of 14 chemical environmental endocrine disruptors. Out of 14 items, 6 were significantly elevated. Okay, that's not surprising. She had a lot of accumulation of environmental toxins. Toxins helped to disrupt her endocrine system. On the right is the final page of the result of her metabolic profile, which is a compound, a test that they measure these metabolites in her blood, in her urine, to sort of extrapolate of her metabolism of the carbohydrates, of fats, of mitochondria, energy, vitamin B, and neuroendocrine transmitters, as well as liver detox capabilities. Anyway, you can see, of course, you can read. It's small and also it's in Chinese, but you can see here most of the items were red, which means abnormal. Only one at the bottom is green. So, and there's more here. And here on the left panel, you see the same patient. You can see the renal, this is, many of you are familiar with this cortisol diurnal pattern. We measure only 24 hours. Of course, you can measure longer periods, but we usually measure 24 hours. As you can see, she is in the early stage of so-called the resistant phase of adrenal fatigue or adrenal insufficiency. The green area in the center is the normal. However, you can see her cortisol level shoots very high in the early morning and too late, very low in the midnight, which is a part of, they classify this into 4 stages of different severity. She's in stage 2. Okay. So basically she has hormonal disruption. She had the thyroid issues, she had adrenal hormone issues, she had sex hormones. So her endocrine system is messed up. Okay. I didn't list here, but she also had some heavy metal. She had only one of them. Most of our patients tested with a lot of heavy metal accumulation. China is known to have more environmental pollution issues than some of the better or other countries in the Western world, probably in the United States, probably. But anyway, so her heavy metal was also shown to have some elevation, but chemical is more of an issue. And so basically, for this particular patient, not only we prescribe dietary control, but also nutritional supplements, mitochondrial nutrients, adrenal repair, as well as BHRT, bioidentical hormonal replacement. So those, in my understanding, is that whatever is safe and maybe effective and affordable, we'll try it, because these are incurable diseases. We're all exploring to see what may help. In this case, the patient definitely clinically she improved significantly. Her periods become normal now, and her mood, her anxiety level improved. Her energy level is much better, and as you can see here, her autoantibodies normalized. This is a TPO. She tested her mother. Basically, she done a lot of testing, and out of a lot of testings, I'm showing you here only the TPO-AB, and it has it is normalized. Okay, and her HbA1c is also within normal range, and so significantly improved. So these are a short list of some of the autoimmune cases that I have seen. We have many other skin rash cases I didn't show you, because like I mentioned, I found that autoimmune diseases can present in many different organs in our body, and skin is a major organ, and oftentimes it shows on skin as rash, all sorts of rash. And so I found the skin rash, autoimmune skin rash, is a great way of so-called pitching to the audience, is because our alternative medicine is different from the traditional classical Western medicine, but a lot of people are skeptical. And skin rash is a great picture. Is first of all, it is getting a lot more common. Many young people, particularly young girls, have autoimmune skin rash, young kids as well. And usually these acute, with reddish rash, and this type of approach with alternative medicine, lifestyle medicine, can achieve significant improvement very quickly, usually within a couple of weeks. Also, it doesn't have to cost a lot. So many people are willing to try. And I found this is a great way of sort of public education to show them this is not a drug treatable disease. It's more of a lifestyle. And once their skin rash improves, they begin to believe more and more in you, and that they are willing to listen to you and to understand. So that's, for our physicians to increase your client base, that's a great way. But also for public education, this is a great way to teach people how lifestyle toxins, nutritional deficiency, lifestyle hurt our unhealthy lifestyle that causes our diseases. And so I play a particularly focus on the skin rash issue. I'm not a dermatologist, but actually I think I know a lot more, or at least I've been able to help many people with dermatology issues, probably than most dermatologists. Now let's talk a little bit understanding the theory part of autoimmune diseases. My understanding now, I put this on first. Oxidative stress. Oxidative stress. This is a hallmark of practically all chronic and acute diseases and aging. I have not found a disease where oxidative stress is not elevated, unless such studies have not been carried out. Okay, and I'm sure you have seen this over and over. I'm not going to go over detail for the, but basically, oxidative. I think I have a slide to show you. The basically oxidative stress is the imbalance of the toxins here listed here, including, for example, smoking, pollution, radiation, processed food, UV light, heavy metals, viruses, metabolism, all these things, and many others can cause elevation of reactive oxygen species or free radicals. Okay, now the antioxidants, including enzymatic antioxidants and vitamins, natural foods, healthy foods, all these things will help to reduce the free radicals. Okay, so the imbalance of which these days we know that the pollution is elevated and a lot of people are nutritional deficient. Therefore, it results in the elevated free radicals, which is basically synonymous with oxidative stress. And in turn, the elevated oxidative stress will cause lipid peroxidation, protein damage, DNA damage, which basically can damage almost everything. And these things can cause pathology to our cells, leading to sickness or cell death, okay, or cancer. So basically, that's the whole the bottom line. And in this, part of the reasons is the, as we all know, leaky gut in autoimmune disease. This is only a partial list of the literature. There's tons of literature on this issue. And the idea here is that the toxins in our food, these toxins can be natural, for example, gluten in our wheat. And as we know, gluten is only a member of the lectin families. The lectins are everywhere, okay? Many of these lectins are a family of proteins. Many of these lectins can do damage to our body. Some of the bad lectins are particularly high in plant-based foods, particularly like legumes. And so we have to be aware of these. Not all plant foods are healthy to you. You have to be aware of these issues. Okay. And not only the lectin, but also glyphosate. I think I have a slide for that. And heavy metals and antibiotics. Basically, the leaky gut concept, as you're well aware of, is that basically it's our intestinal barrier that includes our normal bacterial balance, including our gut lining. When these things are destroyed or disrupted, it can cause issues. The basic concept is that when leaky gut, by its definition, by the name of sake, is that your gut, normally our gut is supposed to filter out large molecules and poisonous or bacteria from entering our body. They do not allow these harmful substances to enter our body. However, when you have leaky gut, basically these toxins break apart of our gastric lining, as you can see here in the picture. There's an opening hole in our gut that allows a lot of the undigested or underdigested food particles or even bacterial viruses to enter into our body, causing all kinds of problems, not just autoimmune, maybe other problems. So this is more and more serious issue. Okay. And as we know, environmental pollution. This is a paper on Lancet, only a couple of months in June of this year, showing you that actually environmental pollution, as you can see here in the red bar, the highest, it's the #1 killer of global deaths. In 2019, it killed close to 10 out of 10 million people died in 2019. 16% are contributed by the environment pollution. So this pollution is a serious problem. Okay, and it's one of the major root causes. Okay, and as you can see here, I'm not going to read it, but the deaths from these pollution have increased significantly by 7% since 2015 and by more than 66% in the last 20 years. That's high. Okay, we are damaging our earth. Okay, and these pollution are associated with cancer and many other diseases, ADHD and autoimmune diseases, autism, asthma, all kinds of things. Probably every disease. Okay, and here's another recent article of autoimmune disease and the pollution. And as I mentioned, glyphosate. Glyphosate has been, it's the most popular. This is probably the most common chemical, man-made chemical worldwide, because this is a very common, the most common pesticide, used in agriculture. And this is one of the major reasons I like to limit the intake in the diet of plant-based foods, because practically today, it is not possible to mass-produced crops without glyphosate or pesticides. So this is a serious issue. And we mentioned about oxidative stress. This is a highlight of the antioxidants and autoimmune diseases. Antioxidants can help autoimmune diseases. As you can see, autoimmune diseases, the environmental pollution elevates the oxidative stress, as highlighted in red here. Okay, and another thing I like to point out is the mitochondria. As we know, mitochondria is another issue. Mitochondrial dysfunction is practically present in every chronic diseases and aging. And again, I've done a lot of research, and I have not found a chronic disease that there's no mitochondrial dysfunction associated, okay, unless such studies have not been carried out. So this is another issue. Therefore, with these understandings, again, this summarizes the oxidative stress. Basically, oxidative stress we can easily understand as the toxin overload versus the deficiency in antioxidant defense. Okay, and that's the simple way to understand. Therefore, how to reduce or prevent a toxin and how to improve antitoxin plays a major role in chronic disease management, in particular autoimmune diseases. And I've shown this over and over. We need to shoot for the root causes shown in green. Don't focus only on the clinical manifestations on the orange to the right. Okay. And modern day medicine only focuses on clinical manifestation with disrespect of root causes. So this is a brief overview, and this is my summary of my understanding of autoimmune, or you can call it my integrative molecular medicine autoimmune protocol, is that starting from healthy lifestyle. Everything counts, everything matters. Attitude, sleep, exercise, but I'm going to talk a little bit more about diet. Here in diet, I already mentioned we want to particularly reduce or restrict the exposure to processed foods, man-made and natural toxins, okay? And so processed foods are a lot of toxins, and mass-produced crops, plant-based foods have a lot of, glyphosate, for example, and also the plant-based foods have a lot of natural toxins, like I mentioned about lectins. Okay, so we don't know in any particular patient what really causing what. So my approach is I tell them, okay, let's go to do whatever you can. First goal is to control the disease, to have the disease slow down or hopefully reverse, stabilized. Then you can figure out which one is really doing more damage to you than others, which ones you can eat, okay? And it's similar to like elimination diet. And of course, these healthy lifestyle, diet, fasting, all these things will also help to reduce oxidative stress and improve the mitochondria. Now, nutrition, of course, this is very critical. But a couple of things in particular is I highlighted in red. high dose niacin, vitamin C, vitamin D3, selenium, not iodine, selenium, not iodine, but these have particular role in Hashimoto, in the thyroid, okay, and the vitamins, magnesium, and mitochondrial nutrition, okay. So here, a lot of research showing, particularly, for example, vitamin D3. I will show you some of the literature. These things, vitamin D3, as we know, low vitamin D3 is very common, and high dose vitamin D3 appears to be closely related to the autoimmunity, and also high dose vitamin D in very high doses. I'm talking about 20, 30,000 units a day to 50, 60,000 units a day, or has as high as 250,000, 300,000 units a day. I've never tried that high yet. Okay, I'm on the way. I'm using like 30,000 units a day for some of these patients, and I'm still learning my way. Okay, and toxins. We're talking about toxins and detox. Okay, and this is a very critical area. And hormonal balance. Again, this is a holistic approach, and on the very low bottom here, also low dose naltrexone, LDN. A lot of research in this area. LDN appears to be sort of regulate the immune disease, and also seems to help a little bit. Again, in my view, anything that is safe and that may be effective and affordable, I try to use it, see what happens, and then gradually figure once the disease is stabilized, then maybe we can start reducing, and to see which ones patient needs absolutely for maintenance, which ones the patient that doesn't need. Okay, that's my approach, because we don't know exactly, right? We're all trying. Here is just a partial list of the high dose vitamin D3. I'm sure you all know. This started about 10 years ago from Dr. Coimbra in Brazil, so-called Coimbra protocol. Recently, just April, a group in Europe, mostly in Europe and America, United States, including Dr. Hollick. He's also molecular medicine doctor. They showed that the safety, high dose vitamin D3, if used properly, can be pretty safe. Okay, and some other articles here. So in summary, here this first of all, no offense is meant here, is that the current medicine, the traditional medicine approach, uses a basic scientist's view. Okay, that's a problem. I think that's one of the fundamental problems in modern day medicine, is that a basic scientist's job is they need to watch, to study things under a microscope, as shown here in this pretty woman under a microscope. Is that a basic scientist's job is to break down a complex system into small and the basic parts, like a cell or a molecule, and study the detail. That's their job. Okay. However, as a clinician, we are not here to treat a molecule, to treat an organ. We are treating a patient. We need a holistic view. We need to put all these things together and form a holistic macroscopic view of the patient, how to manage. We have to balance it, so-called holistic view. These are two different views. When we apply a basic scientist's view in clinical management, disasters will ensue. Okay, and unfortunately today, that's what's in the literature. If you read literature, all these they are talking about any particular drug, one particular drug, even vitamin C. Some of these, well, I'm not going to talk about it. Some people focus on particular vitamin. I think that's also misleading. So we need to have a holistic view, and that's how I'll approach patients. And again, thank you very much, Dr. Bali and Dr. Chai. It's fun to talk to you. See you next time.